Hello everybody, it's Captain Jonathan Klein, Commanding Officer of Naval Support Activity Hampton Roads, here with episode number 14 of Q&A with the Captain. I want to start this week's episode just by saying thank you. Thank you to the men and women of NSA Hampton Roads, to our families that support us, for the tremendous sacrifices you've made over the last 4.5 or 5 months as we've navigated the COVID pandemic. We've asked you to do a lot of hard things, a lot of unpopular things. Stay-at-home order issued by the state of Virginia, the HPCon Charlie measures in effect from the Navy, wearing masks, physical distancing, the sanitation measures that are in place, people becoming teachers and trying to telework. It's been a lot of change and a lot of challenges over the last 4.5 or 5 months, but it was all really for a purpose. There was never any illusion when we started this journey that the command would stay free of COVID infections, but the goal was always to minimize the number that occurred, to delay the onset as long as possible. And then when we did have infections occur, to have effective policies in place in the workspaces so that the infections didn't spread. The spread of infection not only affects our operational readiness, but it also certainly affects the families of our sailors and civilians. And my primary goal is to protect the health and safety of everybody that works here and everybody associated with our workforce. So the work that you've done, the sacrifices you've made, I think have actually paid off for us. So while we've had a couple of positive COVID cases, it certainly has, we've been able to limit the spread so far through your hard work and dedication. The close contact tracing that we've done have resulted in very few people being quarantined as a result of contact with a positive case. And that's really very important for us, and I think it's the key to controlling this in the future. As you watch the news, you'll see that the local areas certainly has an increase in cases right now, kind of a spike for Virginia. The Hampton Roads area has represented more than 50% of cases in Virginia for about the past week, even though we're only about 15 to 18% of the population of Virginia. In the local area, the rates of positivity, the daily rate, has tripled since July 6th for Portsmouth, Norfolk, Chesapeake, Virginia Beach, Suffolk, and a couple others. And so the incidence in the local community is going up. And so those measures that you take to protect yourself, to protect your health, and that of your family are very important. One of the things I did this week is some research on how to make this relatable. So we talk about cases per day and positivity rates and things like that. And it didn't really mean a whole lot to me of 9.9 or 17.2, whatever the numbers were. But it came across an evaluation of the per capita infection rate. So as an example, since the beginning of COVID back in March, about 1 in every 200 residents of Virginia Beach has been infected with COVID or is currently infected. In Portsmouth and Chesapeake, that number is about 1 in 150. And in Norfolk and Chesapeake and Portsmouth, it's about 1 in 120. Those numbers to me are relatable because I can envision that 120 people in a movie theater at a crowded restaurant. And it helps me to understand and helps me to communicate, with my family and to my friends who don't understand why I still can't go anywhere, what the risk is and how we look at it and why we do it to protect that operational readiness. So I ask everybody to kind of keep that in mind as you make choices about what you do in your daily life, and to continue to stay informed and practice those physical distancing measures and protect yourself. Now, speaking of masks, we do have the DoD mask policy that requires it on federal installations. Here in the command, I certainly expect everybody to have a mask with them, to be wearing their mask when they're in the common areas, going to the bathroom, going to the kitchens or their break rooms, transiting the hallways and the ladder wells. And I think it's very important because it protects you, protects those around you, and it just enables us to continue to do our job. It's not going to solve the coronavirus problem that's in the United States, but it certainly is going to contribute to minimizing the spread in our workplaces. I know another topic that's been on everybody's mind is leave and liberty. Like I said, we've really restricted our sailors from traveling like we normally would during the summer, and I know that's been very hard on the families. So a couple weeks ago, the SecDef did change the policy, and Navy followed suit, and we've just signed our leave and liberty policy here locally. That being said, it is still fairly restrictive. We're not going to approve leave to areas that have a high incidence of coronavirus. We do have a local area policy still that limits travel, and you have to comply with the HPCon Charlie restrictions. Now, we're looking at it pretty closely, pretty much every day, and I'll also look at it, how do we incorporate activity-based risk assessment. So if you're going to a wedding or a funeral, that's probably higher risk than if you're going to go hiking on the Appalachian Trail or go camping in the woods. We've not really figured out yet how to make that make the change in the policy, but we are looking at it, and as things develop and we watching the track of our infection rates. I promise you, we continue to look at our leave and liberty policy to try to give our families and our sailors a little bit of the normalcy to their lives back, recognizing that this is not normal times. Finally, speaking of not normal times, if you track our NAV admins, the 193.20 came out a couple weeks ago and canceled the fall PFA, which means we're going to go an entire year without a physical fitness assessment. There are some concerns in this command and in the Navy about what that will do to our level of fitness. So I've asked our command fitness leader to put together a BCA, a courtesy BCA, sometime in the next 30 days for everybody. And my expectation is everybody will go through that and get a snapshot of where you are in your personal fitness goals and within Navy standards. Additionally, there's we've got a lot of resources to support your PT goals. Our MWR fitness professionals throughout the pandemic have been posting to Facebook and doing Facebook Live events, and I think they've even got some Zoom fitness sessions that you can sign up for. And I've done a couple of the Facebook ones, and I will tell you, they remind me how out of shape I am. So I appreciate the level of fitness and the passion and the dedication our MWR team brings to delivering fitness to us. Additionally, there's the Navy Operational Fitness and Fueling System, or NOFS. They've got about 75 workouts online that you can download or watch, or different ways you can interact with it. There's 3 or 4 apps out there to focus on different things, whether it's endurance or strength or core. So I encourage you to look up those resources. Finally, NavyFitness.org developed a 5-week PT plan designed to focus on the core elements of the PFA. And I've asked Chief Louis Jean to put together a sort of an in-house competition. Let's do some sort of PT competition within the command, open to military and civilian, and we'll see what comes of it. I'm hoping to get a brief on it next week so we can roll it out and build some esprit de corps and a little bit of Type A competition there across the command. And then finally, for those of you who are PT studs and still knocking it out of the park, we are running a Command Fitness Leader course next month at Portsmouth Annex. So please talk to your chain of command to sign up for that and help lead us when we do start doing Command PT again and we come out the other side of the COVID pandemic. Till next week, thank you all again for your focus and your dedication and your commitment. I do truly appreciate it, and I know how hard it is during these times. So please stay safe, wash your hands, wear your masks. Till next week, Captain out.